I'm Chris Farrell, and this is On Watch. Hey, everybody, welcome to On Watch, the Judicial Watch podcast where we go behind the headlines to cover news and information that the old legacy media really does not want you to know about. We try to recover some lost history and explain the inexplicable. Today, to explain the inexplicable, we are very fortunate to have Dr. James Thorp joining us. Dr. Thorp, welcome to On Watch.
Chris, thank you so much for having me on your illustrious show.
Thank you
Honor
very much.
and privilege.
Thank you. Dr. Thorp, you're an OBGYN by practice, and you're a specialist in a very, I think, unique field within obstetrics and gynecology. But what is that narrow specialty that you enjoy, that you flourished in?
Well, indeed, I'm very impressed because there's very few physicians that know what I do, and you happen to know it. So you've obviously done an incredible job. I'm one of the 5 or 6 subspecialties of obstetrics and gynecology. There's 60,000 OBGYN docs about in the country. There's very few of us subspecialists in high-risk obstetrics, and we call that maternal-fetal medicine.
Maternal-fetal medicine. That, I mean, those key words right there, I mean, really define what we're talking about. Maternal-fetal medicine. You've only been practicing medicine for about 45 years. That's all. Just a brief period of time.
Right.
So obviously you're a highly experienced, credentialed guy. And you've come to Washington, D.C., and you've come here with a very important purpose. And what is that goal? Why have you come to D.C., and why are you here visiting with us?
Well, I came because Senator Ron Johnson called me up about a week or 10 days ago.
Right.
And asked me to testify if I'd be willing to arrange my schedule and testify as an expert in his committee meeting in the Senate yesterday.
And so Ron Johnson, in fact, he was on our show just a few days ago. We were talking about budget stuff with him. But you come before the Senate, and what are you talking about? What's your message?
Well, my message, I was with a couple of other experts, and my message is an extremely important message, and that is that what happened with the COVID-19 vaccination push in my patient population are the most vulnerable, because my pregnant mother holds in her womb a preborn child.
Of course.
And the preborn child and the pregnant woman are the most vulnerable population of all other populations. Much more higher risk than a child, an older person. They're the highest risk. So it is, I spoke about the most egregious breach of ethics in the history of medicine. So
there's this really, I view it wasn't even a propaganda campaign. It was even more brutal and coarse than that. It was psychological conditioning is what it really was. It was a Stalinist tactic to program and control the American public with an incredible push on these mRNA COVID vaccines. And there was a consequence. And most of them we don't even know yet. We haven't even realized or appreciated what's going to come out of this. But you've been able to draw some, maybe they're not final conclusions, but you've seen some evidence and some disturbing trends and patterns. And what do you, based on your practice, what have you come across? What have you experienced?
Well, having lived through it and watched it, it was just a very, very disturbing. You know, from the view of my clinical practice, what I saw during 2020, when, of course, COVID-19, allegedly all the hospitals were allegedly bursting at the seams, which they were not.
Right.
And I was involved at that time in a very busy practice. In fact, I was employed by SSM Health out of St. Louis, Missouri, and in my 4.5-year stay with them, I saw 27,500 high-risk OBs. So I had my fingertips on the pulse of pregnant women. I knew what was going on. I didn't see any problem at all until after the rollout of the vaccination, and then it was literally a bloody disaster, Chris.
So give me some examples. Tell me some experiences, some observations, some evidence that you have. Tell me about it.
Sure. Well, my evidence comes from my own experience and what I saw with my own eyes.
Right.
But then also, I'm extensively published, and I have a keen interest in researching the truth, looking at data, analyzing data, and publishing it. So I'm extensively published. So the first thing that I did was I went and looked at what is in the government database, right? What are they seeing? What are they seeing and reporting in the CDC FDA database? So I first looked at that when I saw it. I saw a lot of disturbing findings, and it matched with what I saw clinically. And then as I was employed by SSM Health, then what happened was that I would publish those findings. I looked at an 8-month interval of data. I then looked at about an 18-month of data from the COVID-19, and then finally a 40-month look at the data. And each of those got progressively worse. So they were perfectly consistent. What I saw and what everybody else saw around the world that I networked with was the same. Massive increase in very heavy vaginal bleeding, very disturbing, heavy, painful vaginal bleeding, especially in women of reproductive age, women before puberty, before their menstrual period started, and postmenopausal women as well. Difficulty getting pregnant. When they got pregnant, massive increase in miscarriage, very high increase in miscarriage, fetal birth defects, fetal malformations of every organ system you could imagine, late miscarriages. We define a miscarriage up to and including 1 day shy of 20 weeks. At 20 weeks, we call it a fetal death or stillbirth. Okay. So a massive increase in stillbirth, massive increase in severe early onset diseases in pregnancy, every which way to Sunday. Every disease you could imagine, severe early onset preeclampsia, early severe preeclampsia and hypertension, severe bleeding issues, blood clots, severe disease of the placenta, the baby being unable to be nourished by the placenta, deprived of oxygen, growth restricted, reduced amniotic fluid volume, death in the womb, if, God willing, a live birth, then those babies would have a substantial increased risk of going to the neonatal intensive care unit, right, and a significant risk of dying.
Or living, but also increased birth defects or right, some other encumbrance or some other problem in their development, let's say.
That's right. Yeah. The association with cervical insufficiency, which is a problem where the cervix, which should be the size of a woman's fist, same size and consistency, but when that vaccine gets actually seeded, the mRNA, into the lining of the uterus, and it becomes a spike protein factory. And that membrane near the cervix, the internal os here, then starts releasing inflammatory mediators. Cervix opens, you lose a pregnancy from cervical insufficiency, 18 weeks, 20 weeks, 25 weeks. It's disastrous.
So I just want to back up for a second because folks either watching us or listening to us, they've heard, I know many people who have come to me and said, hey, and they tell me really nightmare stories about, sometimes people say it's a turbo cancer, somebody who is healthy or in remission, all of a sudden gets the cancer at a very rapid, and so there's many, many stories out there. you have a particular specialty in this maternal fetal health situation. But when people talk about spike proteins, and they know that that's sort of a consequence of mRNA vaccines, what is a spike protein, and why is it, in a sense, dangerous? What does it do? Why are people paying attention to and worried about spike proteins?
Okay, that's a great question. The spike protein is the one that is made in the Chinese laboratory, and the one that is coded for in the mRNA vaccine,
right,
is probably the most inflammatory bioweapon, inflammatory mediator that exists that I'm aware of. It attaches to the ACE receptor of every single cell that lines the entire vascular system, from the aorta, large vessels, to the capillaries. And once it attaches to that, it causes severe inflammation.
So it is an inflammatory agent or inflammatory element that just pervades the body. And so now all these inflammatory spike proteins are littered throughout the body. The mother who's been vaccinated conveys it to the child.
That's exactly right.
Which then compromises the child and then the environment of the preborn child. And it just sets loose a torrent of potential problems or real problems that result from it. Is that a fair
100%.
layman's assessment?
That's excellent, 100%. And we were told a list of lies. Chris, you know, we were told that the vaccine stays in the arm.
Right. And
when I was blowing the whistle and others saying, wait a minute, no it doesn't, this is an mRNA product, it's a pseudo mRNA.
It's not even a vaccine.
That's
right?
correct.
It's a biological
That's right.
product that's injected.
That's right.
It's gene therapy.
It's gene therapy.
And you used to say that, and people go become hysterical and scream and say, oh, you're full of misinformation. But it's actually what the story is.
Absolutely.
Right.
But so I was concerned, and many of us were concerned, that it could be reverse transcribed into DNA permanently. And if that goes into the sperm cells or the egg cells, which it could result in a permanent change, perpetuity for generations to come. And that was our concern.
And has that been proven, disproven, still out there as a question mark? What's the status of that?
We're still out there as a question mark in terms of perpetuity effect in the human DNA genome.
Yeah.
But let's be real here. In 2022, just a year after, I was concerned about that and others, what Alden and colleagues from Sweden, what they actually showed was that it did just that. In a human liver cell, the mRNA from the vaccine was reverse transcribed by an enzyme called reverse transcriptase into DNA, and it was permanently incorporated into this genome, the DNA of a human liver cell, now in the lab. And subsequent to that, in 22 and 23, there were two peer-reviewed medical journal articles, two separate, by the same author, Hannah and colleagues, that showed that the mRNA, which goes also all over the body and is excreted by all of the glands, was excreted in breast milk, Chris. Two separate studies. The whole mRNA in an exosome, a fat globule containing the mRNA from the vaccine, goes to the breastfed infant. The breastfed infant gets vaccinated.
Consumes it, yeah.
Right?
Yeah.
But we knew that because we now know, and we knew back then that lipid, the lipid nanoparticle was designed. We knew in 2012 that it was concentrated in the ovaries from the study of Schladlich and colleagues in rats, Wistar rats. And then the pharmacokinetic studies, the biodistribution studies from Pfizer, they tried to hide that. Same thing. that the lipid nanoparticle was concentrated 118-fold in the ovaries, which is very concerning. So nanotechnology was designed to go everywhere in the body, to break all of the God-made barriers in the mother, including the mother-fetus barrier, the placenta, and
right.
everywhere in the preborn child.
And they got it.
They got it. So
when it comes to pushing vaccination on COVID-19, a lot of people say, look, if you are young and healthy and generally fit and strong, you might get COVID, but even if you got it, sure, it's miserable. It's, different people were affected by it different ways. But, there was still, I forget the number, but it's like 98% recovery, right? It's a very small percentage of people that really died from COVID. They may have had other comorbidities and other problems medically, but just the average person, you get COVID, you get sick, you're horrible for about a week, and then you bounce back out of it, and you have a natural immunity, let's say, right? And that was my case.
Absolutely.
And so if you're a young person, or even not so young like myself, but nonetheless, if you're generally healthy, you get through it, and that's okay, and you have a natural immunity. Why, I guess it's dollars and cents, but I'll ask you the question anyway. Why this crazy push on the vaccine program? Why this propagandistic, really targeting and psychological conditioning that you must have the vaccine and you must have boosters and you must, and if you didn't do it, you were a threat. You were going to kill your grandparents, or you were going to, they really turned it into a drumbeat. Why?
Well, as you know, they captured all the NGOs with trillions and trillions and trillions of dollars, right? And I think you alluded to it earlier in our visit. This is a fascist mechanism of control.
Right.
You mandate something. The Patriot Act and the PrEP Act, literally, that was PrEP Act, 2005, was preparing us to have the Surgeon General or the head of HHS say, anything that I declare, you lose all your constitutional rights and you will do what we tell you to do.
Yeah.
And so that was a very dangerous thing. Why did they do it? This was a product of the DOD. We now know that. Dr. Peter Breggin has published that, just beautiful timeline, documenting patents, publications. Same thing with Dr. Peter Breggin, same thing with Secretary Robert F. Kennedy in his book. We know that. We know that DOD and DARPA, I think if you today still go in and Google DARPA, DOD, ADEPT, ADEPT, P3, it'll take you right to the website that the DOD tells us in 2012 or 2014 that they were developing mRNA technology to combat what? This whole dual purpose concept. It's good for you, Chris, because we're doing it to protect you, because some bioweapon might come up in the future, and we got to be prepared for it. The whole gain-of-function nonsense.
Right. So women in particular become the focal point of all of the persuasive techniques, and they're really targeted, and they're gone after in a way that, and they're really, in a sense, they're a more vulnerable population for this kind of targeting.
Most.
Yeah, for this kind of targeting. And do you believe that they really, truly understood the consequences of what they were doing? Was it that deliberate, that willfully targeted?
Yes.
Okay.
And please read my book. The name of the book that was just published, just released in February, is Sacrifice: How the Deadliest Vaccine in History Targeted the Most Vulnerable.
All right, and we're gonna put a link to that book in the show notes for this episode. So folks watching or listening can go right into that and click on it, and they'll be able to get your book.
2 reasons. They targeted pregnant women for 2 reasons. First, Chris, is the fact that women make all the healthcare decisions in the human lifespan. That is trans culture, trans ethnicity.
Yep.
That's the way men are different from women.
Yeah.
I'm not an anti-vaxxer. I'm a military veteran. I vaccinated all my children. I even vaccinated and pushed the vaccines even in pregnancy up until 15 years ago.
Right.
I'm a blue blood allopathic physician that drank the Kool-Aid. I believed what they taught me in medical school. I believed the HHS, CDC, FDA, all my colleges.
Well, these are all the experts, right? These are all the smart guys with all kinds of initials after their names that make you figure, well, hell, they must know something, right? That's why they're in this job.
Right.
And you're busy trying to run your personal practice.
That's right.
And all the smart guys are telling you this is the way to go.
Bureaucrats.
Right.
And the second reason they targeted women was very simple. As I've said, if you can convince a pregnant woman that it was safe, necessary, and effective, they've won the whole ballgame. Right. Everybody on planet Earth should be vaccinated if the most vulnerable are getting it. And that's what they did, Chris, over a time span, ironically, of a human pregnancy in mid-December of 2020 to September 27th, 2021. They completely flipped the narrative. Their narrative was, in the early part of that time frame, we're not going to use an experimental drug in pregnancy or recommend it if somebody wants to take it voluntarily. Go up to September 27th, the American Board of Obstetrics and Gynecology sent out a unethical, immoral, illegal, fascist, unconstitutional letter to 60,000 OBGYN doctors. You will push it in pregnant women. You will follow our narratives, or we'll destroy your career, Chris. We'll take away your medical license and your board certifications, and you'll never practice again.
Yeah, and that kind of behavior. So I am blessed to have a number of docs who are friends of mine, different flavors of doctors, and a very dear friend of mine who unfortunately has passed away is a cardiologist. Got the same treatment from Johns Hopkins. All of a sudden, this board-certified, multiply published, heroic cardiologist who's done incredible work, all of a sudden he got the, we're concerned and we need to review and evaluate you, threatening letter, and he has to go up before the tribunal. And, you've talked a lot. You've said things in public, and they're very nervous. And, in my estimation and in his, he's now passed away, but nonetheless, he was targeted by Fauci. He was a big name. He was a big guy, very popular here in Washington, very well-known cardiologist. And they didn't want him going out and talking about the various dangers that you and I have been discussing. And so the solution was to go after him and try and destroy him. Absolutely. And this is exactly what you're saying with the OBGYN career field, the professionals in that college. Do this or we're going to destroy you.
That's right. Look at what they've done to Dr. Peter McCullough, the most published cardiologist in the world. I'm a close friend of his. Look at how he was personally attacked by Senator Blumenthal yesterday. Yeah. That was uncalled for. It was totally inappropriate. And
what does Blumenthal know?
He doesn't know. He doesn't know anything.
What does he know?
Nothing.
He's a liar about his military service, that's for sure. He claimed to be a Vietnam veteran as a Marine officer, and he was a Marine, but he never deployed anywhere. So, it's Blumenthal, for me, he has no credibility. But nonetheless, to me it's disturbing. Look, there can be all kinds of disagreements about treatments and about what works and what doesn't and what your kind of philosophy of treatment is. But when an entire college of physicians or a specialty practice area demands something and threatens people, that changes the whole ball game.
That's not
radically.
Science. That's not science. And listen, there was money involved. And listen, The New England Journal of Medicine, in my opinion, was bribed. In my opinion, there was a money laundering operation, and I published on that last year, my research team and I. There was a flow of money from HHS to the New England Journal of Medicine. In the mid-gestation that I talked about, that transition, in April 21st, 2021, right? 2 separate articles in the New England Journal of Medicine. Chris, the most powerful, influential medical journal in the world.
Sure.
2 articles, and totally inappropriate articles that wouldn't have been qualified. I'm a medical journal reviewer. I've reviewed journal articles from major journals. This wouldn't have cut the mustard for a grocery store tabloid. It wouldn't have. Yeah. Okay. Here you have, the first one was an op-ed with Rochelle Walensky, and then editor-in-chief of the New England Journal of Medicine, Eric Rubin, with his sidekick, Stephen Morrissey. Okay, by the way, the same Eric Rubin, Mr. Science himself, like Fauci, who in the fall of 2021 voted and pushed the vaccine committee in Atlanta at the FDA to push these dangerous vaccines in children aged 5 to 11. And his famous statement, do you remember what it was?
I do not.
Well, his famous statement, on record, check me out, was, well, we're never going to know how safe it is until we just start using it. And then he capped that statement off by saying, that's just the way it goes. Oh, Eric Rubin, is that the way it goes? You have likely killed and injured thousands of innocent children. That's just the way it goes.
First, do no harm.
Right.
Yeah. So much for that.
So then he does, before that, he did the same thing in pregnancy. He and Rochelle Walensky colluded, in my opinion, okay, I'm not an attorney, they committed fraud, collusion, conspiracy, RICO violation, mass assault and battery, and mass murder, because they knew that was dangerous on April 21st, 2021. That was 7 weeks after Pfizer released their post-marketing data that showed it was the deadliest, most injurious vaccine ever rolled out.
So it's bad enough that all that was going on, but meanwhile, in family practices, family medicine practices all across the country, shots were being incentivized. If you could, let's say it's not you, but let's say it's a doc and he's got 3 partners and they're running, the downtown family practice or whatever you want to call it.
Right.
If they can get maximum numbers on every family, every client, they were given, it was like a chart, right?
That's right.
You increase your shots and you get an incentive payment back. It was bucks for shots, basically. That's the way that it worked.
That's right. Remember, even the free hamburgers and the free Happy Meals, and this is unethical behavior. Going into a poorer area of the socioeconomic status and giving people things to get a shot. You remember the famous Fauci and his rounds that he did in a rural area, primarily African American. Do you remember that little escapade?
Yeah.
And then you had this one brilliant African American gentleman who couldn't have been more than 22 years old come out and take Fauci down intellectually in a scientific debate. So it was unbelievable to watch that.
So, this is it's very important, and I'm very glad, thanks, the Trump presidency, Trump 47, brings in a whole breath of fresh air, and people like yourself, other docs, other PhDs, other professional credentialed people who have spent years and years practicing, suddenly are able now to come forward and say, hold on a second. What you're doing is unethical. It defies science. It isn't proven. You railroaded stuff through. You ramrodded stuff through. You unlawfully incentivized or in some way sort of bribed or cajoled people. You engage in a propaganda campaign. You psychologically condition the public to behave in certain ways. I still see people walking around with masks on.
I know, isn't it weird?
I mean, maybe they have some condition that I'm not aware of. I'm not going to pass judgment on it. But there's some people, you know, the red MAGA hat, they've got a blue mask, right? That's their political statement.
That's right.
But thank God we now have people that are willing to push back and get some accountability. What's your prognosis for real accountability? Are we ever going to get the full story, and we're going to get, I mean, some stuff's going to take 10, 15 years to work itself out, right? Long-term consequences of things that we just don't even realize right now. But as far as like RFK and the new leadership within the government of docs, medical professionals, are we really going to get some kind of accountability?
It's a great question. You know,
Sorry to put you on the spot, but
you know, just for the record, you know, I've been at this since 2020 when I realized it was coming, and I've been persecuted, my death threats. I've been fired from SSM Health and lost my job because I lifted my publications up like a good soldier to my chain of command.
Yeah, and I know other docs as well who have tried to do the right thing, and their local hospitals told them, we really don't want to give you privileges anymore. You can, you can go off and be a solo practitioner, but you're not affiliated. Beat it.
Yeah, so my research team, including my wife, Maggie Thorp, JD, incredible attorney, we published extensively on the America Out Loud platform. Literally, in one of our publications, of course, she gets credit for breaking the Freedom of Information Act request that busted HHS CDC of bribing the American, I'll say, giving money in a quid pro quo agreement. I think it's better termed, in my opinion, as a bribe, but then capturing 60,000 OBGYN doctors. But also, you talk about hospitals. We, in a separate publication, Maggie Thorpe, JD, and I exposed, extensively cited, and $186 billion, Chris, $186 billion with a B to over 420,000 hospital systems and clinics with what we believe is the exact same quid pro quo agreement. You keep the money, you don't have to pay it back. But by God, Jim Thorp is getting, he testified in the Senate 3 years ago. He was on Tucker Carlson. He was on Chris Farrell. SSM Health fired me 2 years ago almost for while being hailed as one of their model physicians, right?
Yeah, it's always a little schizophrenic.
Right.
So you're a genius and they love you and you're on the board of this and that, and then all of a sudden, oh, you're a horrible person. Right, they flip like on a dime.
They didn't flip on me. They had enough. My patient scores were so high, and I was so well respected by all my organizations my entire career that they said they had the CEO Kevin Elledge call me up, and one of the CEOs, and say, Dr. Thorpe, you're a great doc and you're a model physician,
but
we're having some financial problems. We have to terminate you for no cause. You've been a great doc. Everybody loves you.
We're just going in a different direction.
Right. And then he went off to try to get me to sign an NDA for $90,000. That was I would interpret that as a bribe.
It's an incentive.
Right. And in my contract, I had another 120 days to work for a termination for no cause. And when I refused the what I would call a bribe, I was fired on the spot.
Of course. That's how the game is played. That's the penalty. It's a sad commentary on the whole system.
It is.
And I mean, even on a good day, organized professional American medicine is a nightmare, right? It's something inconsequential, whether you have a broken bone, right? Set the bone or not. That kind of, just the process of going through, hospital and medical care. It's horrendous. on a good
Right.
day, let alone something contentious like what you've been dealing with.
Exactly.
Yeah.
You ask me, how long will it take? Will there be accountability?
Yeah.
I believe that we should have special counsel investigating not just Fauci and not just Daszak and many others, but I think people that were at the head of these medical organizations, I believe they should be criminally prosecuted for all of the charges, including the doctors in these organizations that took the bribe.
So are you talking about like these firms that own and run hospitals, like pharmaceutical firms? There's all different flavors of professional medical organizations. So whether it's a parent company that has a chain of 10 hospitals, or whether it's a pharmaceutical firm, or so all these guys you're saying should be subject
Well, I believe, it's my opinion, Chris, that the three organizations that perpetrated what I believe is the greatest ethical breach in the history of medicine, that's the American College of Obstetricians and Gynecologists, ACOG, the American Board of Obstetrics and Gynecology, ABOG, and the Society for Maternal-Fetal Medicine, SMFM. They took the money, they forced their constituents, they breached their ethics, and they forced these 60,000 people to push the vaccines in pregnancy. I believe, in my opinion, that's not a civil offense. I believe that's a criminal offense, and I believe it resulted, listen, as goes the United States of America and those three organizations, so goes the world. I believe they're responsible for killing and injuring millions globally of pregnant women, preborns, including all the miscarriages, and newborns.
Right.
And I believe they should be criminally prosecuted.
Your papers and some of the background reading I did in preparation for this interview, you make, or at least you point to, a possible conclusion about the loss of, viable or possible eggs in women of childbearing age. I may not be phrasing this exactly correct, but so please correct my lingo because I'm
No, you're good. You're on spot.
So you have childbearing women. So pick your number, 17 to whatever the number is. I don't know. And you're saying that because of these mRNA vaccines, that there could be an impact on them actually losing the number of eggs that they normally would have in their childbearing time frame or span.
It gets worse than that.
Okay.
It gets worse than that. That's exactly what I've seen. But you're referring to a study that was just published by Cameron and colleagues, just published from Turkey, a study that looked at egg reserve. And by the way, the only other research group in the world that I'm aware of is my group, the Advanced Biological Research Group, that are looking at these, abrg.org. There's 6 of us founding members. Dr. Stephen Hatfield was one of them until he took the position here. But it gets worse. It's not just women of reproductive age. These injections to even pregnant women traverse the placenta, and the female fetuses, the poison, they're affected. So there's a 60% reduction in eggs, even in the female fetus before she's born.
Wow.
And that was the study. And that's what I've seen. So, that's why these women who have gotten the shot, whether they're 18 or 35, have experienced premature menopause because they have no more eggs left.
Wow. That's, I'm imagining some woman in her 20s or whatever, all of a sudden, bang, goes into menopause because it's a consequence of the shot itself and the number of eggs. Because I guess every woman has a certain number, and when they're gone, they're gone. But that's
right.
Yeah.
And remember that, and for the audience, again, Advanced Biological Research Group, abrg.org. Listen, us 6 founding members, we have put thousands and thousands of dollars of our own money, let alone thousands and thousands of hours. We have a study. We're the only group in the world that are, to my knowledge, that are working on this. Because remember, Chris, the federal government won't fund us. The pharmaceutical companies won't fund us. We have to fund our own research.
Right.
And this is important to the human race. This is our future, Chris.
Yeah, this is really very, very grave stuff, and the consequences of which I don't think are even, I think we're only thinking about or considering a fraction of what the really long-term potential is. And again, some stuff we're not even going to really appreciate or realize until it's 10, 15 years down the road. But so you're up on the Hill, you give testimony. How was it received? Tell me what the reaction was or what the questions were like from the people on the Hill.
Yeah, well, I will say I don't remember a lot of it, but my friends that were there told me that after I presented, I had the longest ovation.
That's
so
great.
It seemed, and there were a lot of people that attended it. But, you know, I got some great questions from Senator Ron Johnson. None of the other senators asked me questions.
That could be the highest endorsement there is. When the rest of them all shut up because they're afraid to ask you something, that's a good sign.
Yeah, but when they attack a close friend of mine, Dr. Peter McCullough, that didn't sit well, and I got very angry.
Yeah.
That was uncalled for. He's a dear friend and a colleague. He's the most extensively published cardiologist in his area in the world.
Yeah.
And he's the most brilliant physician I've ever met in my life.
Well, that's why they go after him like that. I mean, he literally is like the poster child for this.
It's awful.
And so they go after him with a vengeance.
It was hard for me to contain my anger.
Yeah.
You know, I wanted to.
I get it.
I won't say anything.
Believe me, I get it. Yeah. Because he's forgotten more than they will ever know.
Right. Oh, he doesn't forget anything.
No, but I'm just saying,
man,
when you're dealing with people like Blumenthal,
That's right.
who are really certified idiots, right? I mean,
Right.
So how is he going to question, you know, these very experienced doctors, including yourself? Why this guy? I mean, he can barely string a sentence together. So why in the world could he be in a position to, you know, ask some penetrating question that no one else has asked before? You know, it's preposterous. Yeah. So that's great. I'm glad that you had a warm reception and that, like I said, good ovation and applause or affirmation of what you said. So what's next? So, I mean, a lot of times I've had tons of people come on the show and say, well, I went up and I testified before Congress. And they're great for sound bites, but now we need the follow through, right?
Right.
So now we need, you know, who's going to say or do something 6 weeks from now, and that's what I'm always interested in. We have very long memories here at Judicial Watch. I can tell you all about Gardasil, right?
Yes. Oh, yeah. Oh, yeah.
So believe me, I remember stuff people don't want me to remember.
That's right.
But you know, looking down the road, what are next things to look at or hope for or watch? Like who's going to be doing studies or interviews or just like what's coming?
You know, listen, for the audience, I estimate that there are 30 million American victims of the COVID-19 vaccine. And, you know, it is horrendous, the injuries and the deaths that have occurred. So get out and speak, voice, advocate, take down this mRNA platform. Audience, I know the numbers. Okay, none of you, or hardly any of you, whether you're on the right side or the left side of the political spectrum, here's what I know about you. Only a small, very small single-digit percentage of you have taken the COVID-19 vaccines in the last 18 months. Some estimate a pathetic less than 5% or 1%. That means 95 or 99% of you know that your doctors are lying to you, know that the medical organizations are lying to you, know, more importantly, that your government is lying to you, and they're still pushing this very dangerous mRNA that is not fit for human use. So, ladies and gentlemen, especially women of reproductive age, pregnant women, advocate for your own health. Don't trust, do not trust the government. Advocate, do your own research, do your own due diligence. There's an incredible book out there, many resources out there. Look into it and make your own decisions based on knowledge, not on fear.
That's really the problem. So now, let's say there's a young woman out there who's 28 years old, and maybe she has one kid and either thinking about or there's a second one on the way, and she believed the propaganda. She did as she was told, and she got the shot, and now she's sitting there saying, now what the hell do I do?
Yeah.
What have I done to myself? What have I done to my kid? How do I go forward? I mean, we have to give, I think it's incumbent upon us to give people like that, families like that, hope, but also a path. Like, what is the route? What do you do? Obviously you have a website for your research organization, but there's books, there's other docs, there's got to be some kind of referral network. I mean, so if my wife was having a kid, we're going to go see you, because I'm going to trust that you have the judgment to do the right thing, to have a successful, happy birth, and everything works out great. Maybe it doesn't, but we're going to do everything we can to make sure that happens. So what's the path forward? What's the responsible way forward?
Well, there is hope, Chris, and I've had so many women call me and ask that exact same question, and I give them hope. But for a woman who's had multiple losses to come to that point, that's very hard. Chapter 7 in my book is called 8 Candles. And Celia, my co-author, and I interviewed this couple. They had a normal first baby before the shot. After the shot, 8 catastrophic losses.
That is
2
crushing.
sets of twins, late miscarriages. And the last one, Chris, a massive abruption before the day or a couple of days before a cesarean section, massive abruption, fetal death, and she almost lost her life. This particular person can't come to grips of what you said. I realized, I connected the dots that it was the vaccine. She can't do that because it would be like it was her fault.
Right.
She can't come to that, so she alienates, loses all of her family, all of her friends that are. So I applaud any woman that comes to that. If they come and they seek my help, there is good hope. And there's a couple of tests that we can do. There are, somebody that got the vaccine, I have many patients that got the vaccine 4 years ago, Chris, and they still are making massive amounts of spike protein, several of them. That's 4 years later. That's over 1,500 days. Yale study showed 701 days. So the first thing to do is before you get pregnant is let's test. Let's see if you have
what's your body doing?
How much of that spike poison do you have in you?
Right.
And if you do have it in you, let's clear it out. Let's make your immune system healthy by bringing your vitamin D levels up from the lower limits of normal, which are 30, up to 90 or 100, because the vitamin D, it's an insult to call it a hormone. It is the master symphony director of the entire immune system. It modulates probably 250 genes. That is God's gift to us. We are made in God's image, and our immune systems can heal themselves.
Yeah.
So we have to correct and fix our immune system, we have to clear that spike protein. Dr. McCullough protocol with the extended spike supplement has good science behind it.
So there are mitigating factors, and there is a way forward. And somewhere in the middle of the COVID saga, after having had COVID, I said to a health practitioner, I believe in natural immunity. I just got over COVID about, I don't know, whatever it was, 6 weeks or 8 weeks ago, and I think I'm in a pretty good position right now. And they smirked and laughed. As though natural immunity is like some mumbo-jumbo mythology thing.
Right.
Preposterous, right?
And now we have almost 7 studies that show, including the Cleveland Clinic, COVID-19 vaccines, they don't prevent infection, they increase the risk, negative efficacy.
Yeah, it's terrific. But I'm very glad to hear that there are some other mitigating factors, some things that can be done, that there's a smart way to approach this, that it is not a doomsday scenario necessarily. Obviously, it's not great, but it's not the end of the line. And because I think people need to know that and hear that, because there's so much negative stuff, right? And negative stuff, I mean, you can't deny it. You can't, refute, fact, historical and scientific fact. You can't just play ostrich and stick your head in the sand. But you also don't have to go into a doom loop, right? A spiral of negativity.
That's right.
There's a happy medium in there, and you can say, all right, well, what are some proactive things I can do to make my condition the best I possibly can? And take it from there.
Absolutely correct.
Good. That's good to know. So I know for a fact that folks are going to love this interview, and they're going to want to know more about you and about your work and about your organization. So once more, let's have the book. Let's have the website, your .org website of the organization. And then people that are interested in reading more of your work, if your website, whatever else, tell us how folks can follow what you're doing.
Well, thank you. And I want to say that my book, Sacrifice, How the Deadliest Vaccine in History Targeted the Most Vulnerable, I'm not taking one dime from that book, ladies and gentlemen. All of my profit is being donated to the wellness company, who I challenged to match my donations with my wife Maggie. They're going to match it. It's a 501c3, and it's accumulating a lot of money. The wellness company is donating a percentage of their sales, and we will be distributing every penny of that fund to those, I believe, millions of Americans who are COVID-19 vaccine victims. We've already made our first award to the Martin family that lost their beautiful 18-year-old daughter, was killed by the Pfizer vaccine. Our second award is being made. So this is not to line this is the reason for my existence for the rest of my life will be to protect and to serve and to try to do whatever I can for these vaccine injured that have been thrown under the bus by our healthcare system and by our government. So the website, of course, for that book is sacrifice2024.com. The Sacrifice for the Advanced Biological Research Group is abrg.org. You'll read all about us. By the way, our second study is looking at the ovarian reserve in humans. The third website I'd like you to look at is my personal website. It's drjathorp.com, drjathorp.com. No E on the end of my name. And you can follow me on X, formerly Twitter. My account is at JATHORPMFM, as in maternal-fetal medicine.
Very, very good. So, all of you out there, whether you're watching or listening to this podcast, you need to listen to what Dr. Thorp says and his 45 years of medical experience. And, unlike a lot of people, you put it on the line, right?
Yes,
you say what you mean what you say. You've put yourself and your own practice at risk when the rest of big medicine says, do the following or, get your head cut off. You stepped up and said, nope, not me. I'm not playing along.
I did, and so did my wife.
And congratulations to her as well. And there's a handful of other docs like yourself who have been very forthright in coming forward and trying to fix things and make things right. So we are enormously grateful, enormously grateful. The country owes a debt to you guys for having enough guts to stand up and say, whoa, no, this is not true, and we need to be responsible about what we're doing. And so anyway, you have our thanks.
Chris, it's been such an honor and a privilege to meet you and to be with you.
Thanks. So please be sure to follow Dr. Thorp and his work, get his book, read up on his activities and his studies, and maybe you have family or friends who are in a position where they need some guidance and direction, they need some hope, and I just encourage you to get as much information as possible. And Dr. James Thorp is the guy to I think go to and follow and comprehend and consume as much fact and information as you can so you make informed decisions about your health and the ones that you love. So with that, I'm Chris Farrell on Watch.